guys, so in this lesson, we're going to talk about ventricular tachycardia, also called VTach. We're going to break down the characteristics of it on an EKG and talk about nursing interventions and treatments for VTach. Now, this is a pretty important rhythm to recognize because people can die quickly if we don't do something about it. So let's go ahead and get started and talk about VTach. So in ventricular tachycardia, there are multiple unorganized electrical signals in the ventricles. This causes the ventricles to contract at a rate of 150 to 250 beats per minute. So we have all these irritable cells here, and it's just sending off an electrical impulse, and the ventricles are just contracting very quickly. So obviously they don't have enough time to slow down and fill up with blood, so the cardiac output is significantly decreased. So sometimes when people have VTach, they may or may not have a pulse, and that is the first thing you need to check when you see this rhythm. So let's break down the characteristics of it on an EKG. In step number 1, we look at the rhythm and we got to find out, are we regular or irregular? So here, let's try to count some boxes in between the R waves. From that one to that one, we can say we have about 11 to 12. From here to here, we have about 10 to 11. Here to here, we have about 12. So for the most part, it's between 10 to 12. So we can say that the rhythm is regular. With VTach, it will either be regular or irregular. In step number 2, let's count the heart rate. So we have 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13. So that's 130, but let's do the 1500 method. And we're just going to go ahead and divide it by 11. So we have 136 beats per minute. Now, I know what you're going to say. In the previous slide, you said that the heart rate had to be between 150 to 250 beats per minute. Yes, that's correct. In this particular slide, we are at 136. Give it a minute. If we keep watching this, it's going to climb on up there. This is still VTach. Sometimes it can be a little lower than this particular rate, but if we leave this alone, don't do anything about it, it's just going to keep getting faster and faster. So for the most part, it has to be between 150 to 250, but this is obvious VTach, okay? In step number 3, we got to look at the P to QRS ratio. Do we have one P wave followed by one QRS, and it is not measurable because we don't have any P waves. In step number 4, we got to do the PR interval, and this is also not measurable because we don't have P waves. Step number 5, let's do the QRS complex. So let's do this one. From here to here, we have about 5, 10, we can say about 11 boxes. So it would be about 0.44 seconds. So the QRS complex is usually wider in ventricular tachycardia. And in step 6, we identify the rhythm, which we have VTach. So let's recap the characteristics of it. The rhythm can be regular or irregular. The heart rate is usually fast, okay, greater than 150. Again, if we left this alone, trust me, it's going to climb on up there. The P to QRS ratio is not measurable. The PR interval is not measurable. The QRS complex is usually pretty wide, okay? Now, this is one of those rhythms that when you see it, you cannot stop and look and go through the steps and try to identify it. This is one of those rhythms that you make a jump for it. You go in the room. First thing you got to do is assess your patient, make sure they have a pulse. You do not mess with VTach. People can go into cardiac arrest and die if we leave this rhythm alone. So let's talk about managing it. So most patients that come in with ventricular tachycardia, their clinical presentations are palpitations, chest pain, and usually the cardiac output will be decreased, so they'll be hypotensive, LOC changes, lightheadedness, and syncope. Your priority nursing interventions, the first thing you got to do is find out if there's a pulse or not. People with VTach can have a pulse, and sometimes they cannot. It just depends on the severity of the cardiac output. So always find out if there's a pulse present or not. Now, find out if it's sustained or unsustained. Basically, what that means is if I have a patient who is in a normal sinus rhythm, and then all of a sudden, that's a little QRS. One more. all of a sudden they go into a run of VTach, and then they go back to a normal sinus rhythm, well, that would be that it is unsustained. They just had a run of VTach. And that's not okay, but usually it's because of an electrolyte abnormality, so you try to find out why this is happening. If it's sustained, that means this is happening and the VTach is not going away. And then you got to find out if it's monomorphic VTach or polymorphic VTach. Monomorphic basically just means are they the same? Are the QRS complex the same? If you look at this one and these two right here, they pretty much look the same. So if the entire strip looked like this, we would call it monomorphic VTach. But because some QRS complex look a little different right here and right here, they don't all look the same. They are different. It is called polymorphic. So this is polymorphic ventricular tachycardia. So now let's go ahead and talk about therapeutic management for VTach. First thing, if you can, determine the cause and try to treat the cause. If it's because their potassium or their magnesium levels are abnormal, fix that. If it's something more serious like an MI, well, then you got to take them to the cath lab so they can open up that blockage. If they have a pulse or don't have a pulse and you see this rhythm, we got to follow ACLS guidelines. So if you know that your patient has a pulse, we can start them on amiodarone. Usually we do a bolus of 150 milligrams and then follow 1 milligram a minute after that. We can also do a magnesium sulfate, which is either 1 or 2 grams, just depending on what's ordered. If that does not work and the VTach still persists, we can do a synchronized cardioversion. And if they don't have a pulse, basically they are in cardiac arrest, we have got to start some CPR, defibrillate them, and give them epinephrine according to the ACLS guidelines. I want to just briefly mention synchronized and defibrillate. A lot of people are very confused about it. So here's my patient. And they are connected to the monitor. And here are the pads attached to my patient. So again, if I set it up for synchronized cardioversion, it syncs with the R waves. So it delivers the shock after repolarization. Unsynchronized cardioversion is the same thing as defibrillate, meaning whenever I push the button here, charge, and then I push the button to send the shock, it just sends it as soon as the button is delivered. Okay? This syncs. This does not sync. This just sends it whenever I push the button. Again, whenever you shock somebody, make sure that no one's touching the patient. So the key points to take away from this lesson are to remember the abnormalities of VTach. It is a rapid ventricular contractions. It's usually at a rate of 150 to 250 beats per minute. They may or may not have a pulse. It really just depends on the cardiac output. Nursing interventions, first thing you got to do is assess the pulse. And then you follow ACLS guidelines. If the pulse is present, we can do med or a synchronized cardioversion. If they do not have a pulse, they are basically dying on you, do CPR, defibrillate them, give them epi, do whatever you got to do to save their life. So I hope that you guys have enjoyed this lesson and feel more comfortable identifying ventricular tachycardia and that you know what to do when you see that rhythm. Make sure that you check out all of the resources that are attached to this lesson and go out and be your best selves today. And as always, happy nursing.